Hi. Today I wanted to talk to you about some of the medications used in fertility treatments. So when we talk about fertility treatments, obviously we have IUIs or insemination procedures and IVF, which is in vitro fertilization. But on the insemination side, what's typically done is we have medications known as Clomid or Femara. These are the brand names. The active ingredient or generic is clomiphene citrate or letrozole. And these are pills, and they're used in a variety of different treatment options, but they are used quite commonly in the IUI cycles. So when we talk about these two medications, there's some data that says both of these medications are equally as effective in helping women get pregnant. Clomid is kind of the older medication, tried and true. Femara is a little bit newer. It's actually was used for breast cancer treatments, and ultimately they found that people were ovulating more regularly when they were treating women with breast cancer, and then they realized they can also use it for fertility. Now, there was one paper that came out, or a paper that came out that talked about with Femara, you in PCOS patients, PCOS, and we'll get to what that means later, but in PCOS patients, Femara was shown to be slightly more effective than Clomid. So you'll sometimes see patients go on that are PCOS, Femara over Clomid. But again, that's personal preference from physicians. And so don't take that as gospel, but that is something that you might hear a patient say from time to time. Now, there are different doses that these come in. So Clomid comes in 50 milligram tablets, and letrozole is 2.5 milligram tablets, okay? And that's the only strength that it comes in, are 50 milligram tablets and 2.5 milligram tablets. But when you talk about protocols that clinics write for these drugs, they will write for Clomid 50, Clomid 100, and Clomid 150. On letrozole, you'll see them write for 2.5, 5.0, and 7.5. So what that comes out to is 1 tablet, 2 tablets, 3 tablets. Again, same thing here, 1 tablet, 2 tablets, 3 tablets. And so in these medications, the way they're written for is 1 tablet PO Q day for 5 days, or 2 tablets PO for 5 days. So when you see these prescriptions, that's what that'll look like. If someone writes for Clomid 150 milligram tablets, that doesn't exist. And so those are some things that as pharmacy technicians and pharmacies, we have to clean up. So this is a little bit about Clomid and letrozole. I want to kind of go over just a little bit in terms of how they're typically written. So they are usually written for, let's write this in green here. So they are typically written as a 5-day course. The package insert actually says to do it days 5 through 9. There are also really quite commonly is days 3 through 7 and days 4 through 8. But basically, any day 3 through 5 are the most common times for people to write for that. These medications are typically written as either Clomid or Femara, but there are even some providers who will write them Clomid plus Femara. It's not that common, but you might see it. So that's a quick overview on Clomid and Femara. We'll go over more of that stuff later, but just wanted to get you a quick video to go over the basics of these two medications that are used quite commonly in fertility treatments. Thanks so much.